Hey everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about another antidepressant. This one goes by the name of Venlafaxine. Its brand name is Effexor. Before we get into the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Many of the antidepressants we covered in previous episodes fell in the class of SSRIs, or selective serotonin reuptake inhibitors. This time we're going to be talking about a medication that is an SNRI, that is serotonin norepinephrine reuptake inhibitor. The main indication for this medication is MDD, or major depressive disorder. However, it does have some other uses as well. It's been used in generalized anxiety disorder, as well as social anxiety disorder. It's been used to treat the depressed phase in bipolar disorder. Venlafaxine has been used in postpartum depression. Double-blind and open trials report efficacy with venlafaxine treating OCD. However, you would need to use a higher dose in this situation. Case reports have shown that venlafaxine can be effective in chronic fatigue disorder. Women who experience hot flashes during menopause may benefit from venlafaxine. And occasionally, people may try using it for migraines or tension headaches. Without getting into too much detail of how this drug works specifically, it does block the reuptake of serotonin and norepinephrine. However, it should be noted that to successfully block the reuptake of norepinephrine, the dose of venlafaxine would have to be at least 150 milligrams. Now, before somebody was to start using this medication, there are some precautions or warnings that should be considered. One that's very important is that this medication has been shown to occasionally cause an increase in suicidal ideation as well as hostility in adolescents especially. Therefore, all patients must be monitored closely when starting these medications for worsening of depression as well as suicidal ideation. Another thing to consider is that this medication does have an effect on norepinephrine, therefore it could be a concern for people that have cardiovascular issues. We tend to avoid this medication in people who have uncontrolled hypertension or uncontrolled high blood pressure. Venlafaxine also has the ability to induce mania in individuals who have bipolar disorder. Because of its effect on serotonin, if somebody is using this medication alongside other medications that also affect serotonin, this could put people at an increased risk of serotonin syndrome. There have been reports of toxicity with venlafaxine, so it's very important to take the medication as prescribed by your physician. One thing that's very important with venlafaxine is that after a patient is stabilized on the medication, they should not discontinue the medication abruptly. It would be imperative that they contact their physician to make a plan to come off the medication. There have been discontinuation syndromes that have occurred in individuals stopping the medication too fast. Some people experience lethargy, nausea, diarrhea, vomiting, headache, fever. Some people start to sweat and get chills. Some people experience vivid dreams, and others describe an electric shock syndrome. If somebody was to experience this syndrome after discontinuing venlafaxine abruptly, it would typically happen at about 7 days after your last dose. After about 3 weeks, the syndrome should clear. The dose of venlafaxine should be tapered over a course of at least 2 weeks, but some people recommend doing it over the course of 6 weeks. Some people even recommend taking 1 dose of fluoxetine near the end of the taper because it has such a long half-life. This is thought to help with withdrawal symptoms. So after somebody is made aware of all the precautions and warnings surrounding venlafaxine and they start taking the medication, they can expect to start taking it in a capsule form at a strength of about 37.5 to 75 milligrams. After a week of taking the medication, it can then be increased by increments of no more than 75 milligrams every 4 days until reaching a dose of about 225 milligrams. The dose is typically taken twice daily, unless of course you're using the extended release version. In that case, it would be taken once daily. Medication can be taken with or without food, as taking it with a meal has no effect on its absorption. Now, as with all medication, there are some adverse reactions or side effects that people may experience while using venlafaxine, so I'll go over some of those with you now. Drowsiness, sedation, insomnia seem to happen over 10% of the time. Headache or confusion comes in at 10% as well. Some people experience some anticholinergic side effects after using venlafaxine, such as constipation, blurred vision, dry mouth. Of these, dry mouth would be the most common. A little over 2% of people experience extrapyramidal side effects such as tremors. Orthostatic hypotension happens in about 10% of people. And less than 2% of people may develop a rapid heart rate or see changes on an ECG. GI distress seems to be common with venlafaxine. It happens in over 30% of people. And sexual side effects come in at over 30% as well. This could present as decrease in desire or decrease in performance. That's all we're going to talk about today with Venlafaxine or Effexor. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There are also some links you can check out in the description as well. Alright, take care.